Good afternoon. As the weather has brightened up in here, we have also come right in front of you so that no delay. Like we are, want to make sure that you all are on the toes and as interested as ever. You're ready to go. Is that that? Are you all ready to go to your dream country? So we in Neethu's Academy will always ensure that we become the bridge between you and your dream. We want to make sure that we come and help you to the maximum in order to make sure that all of you are benefited. So, a very good afternoon to all my lovely students. Bessie Benoy, good evening, very good evening. So, on behalf of Neethu's family, welcome to another live session with me. Okay, what are the things that Neethu's Academy offers for you? We do offer an array of training for a lot of linguistic exams. As you can see on the screen, if you want to get more insights about, please do not hesitate to contact our admin. We'll be happy to assist you. Rajimol Praveen, good afternoon. And if you want to know what other things that we offer, we do offer regular batches as well as crash courses. So any insight that you want, do contact us. Miss Sirijo, good evening. Ampili Anil, good evening. So what is the next available slot? The next available slot is only from August, September, October. And that is also gonna close soon because our students are really willing to wait and we appreciate that. So Neeraja, good afternoon. And we only have 2 Telegram groups. So please do understand, do not fall for any such kind of other group that they contact you. We have that, this is from us. No, we come straight to you. We have only 2 groups. One, the official Neethus Academy Telegram page that we have pinned the message. So just click that message, you'll be taken to that group. It's a free group. And the other one is an exclusive reading Telegram page where you have the first-hand information about all the Neethus Academy material and about reading. Okay, in that group, we have done a scrutinizing policy because we do check, and after that only we'll be accepting you into that group. Even though it's a free group, after double checking the background, because we want to avoid these unwanted people entering into that group. Chinju Joseph, good afternoon. Savita Sunil, good afternoon. A small, as always, I will request a small request. Anybody attending for the very first time? Angana Arengilu. Liba Libin, good afternoon. ആരെങ്കിലും ആദ്യമായിട്ടാണ് ഈ ക്ലാസ് അറ്റൻഡ് ചെയ്യുന്നതെന്നുണ്ടെങ്കിൽ ഒന്ന് പറയാം. Is there anybody who's attending for the very first time? എന്തിനാന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ it is just to Sajjeev, good afternoon. It is to show the lovely people, you all, the effort that you put in order to share the page, like the page, subscribe the channel. It's an absolute stun. Okay, the passion that you all support is just, Priyam, good afternoon. So we are the leader in Telegram. If you really look into, our subscribers are always on the top. Okay, that is because you all trust us. Okay, that's what we are so much in love with all of you. കാരണം നിങ്ങളുടെ സപ്പോർട്ട് കൊണ്ട് മാത്രമാണ് നമ്മൾ മുമ്പോട്ട് പോകുന്നത്. ഓരോ തവണ every time when a class is there, the number of participants, okay, after that, during that time. Jasna, good afternoon, happy to see you as well. Vidya Ranjit, good afternoon. Amrita Dev, Ernakulam, after a long time, Amrita, if my memory serves right, okay, I can't really, because there are 2 Amrita, one from Trivandrum and the other one is from Ernakulam. Right. So ആരെങ്കിലും ഉണ്ടോ attending for the very first time? ഉണ്ടോ? Yes? No? ഇനി എന്തിനാണ് നിങ്ങളുടെ അടുത്ത് ചോദിക്കുന്നതെന്ന് പറഞ്ഞാൽ, see, it is about validating your presence. നമ്മളിപ്പോൾ ഇത്രയും കഷ്ടപ്പെട്ട് you're going to go to that country where you have to grab the opportunity. Trivandrum, okay, so it is almost similar, isn't it? കാരണം രണ്ടാമത്തെ one was from Trivandrum and the other one was from Ernakulam. So you are from Trivandrum. Okay, fair enough. My memory is still working. I will check it. Right. So, Aringondo, attending for the very first time, Lekha Baiju. Good afternoon. So, very, very, very good afternoon to all my lovely students. Okay. And what are the things that we do in this live? Okay. This is live for reading. Okay. I come in the very same page, the very same panel that you're watching. If you want to get more insights about listening, do not worry, we will not leave you like that. Chris comes every day with his listening classes. But that class is on Zoom. Okay. So if you want to get the Zoom link, just click that Telegram page that we have pinned. It will have. Okay. Rinsi John, good afternoon. Beena's career, hi. Then every day we post grammar challenges. That is also coming in that very same Telegram page. Then on top of that, Neethu madam comes in front of you with writing. She just completed and then she'll be coming on the third Friday. Ashmi Anthony, good afternoon, a new name. So, please do let me know that you're attending for the first time. See, they take that big effort in sharing in their social media. They should also feel that അവരുടെ ഷെയർ വെറുതെ പോയി അവർക്ക് ഒരിക്കലും തോന്നരുത്. കാരണം because they share it because they feel that it is important. അല്ലേ, നിങ്ങൾക്ക് ഒരു കാര്യം ഇമ്പോർട്ടൻ്റ് ആണെന്ന് തോന്നിയാലല്ലേ നിങ്ങൾ ഷെയർ ചെയ്യുള്ളൂ. You don't share anything which is an absolute absurd, isn't it? അപ്പം so for all those students who share, നിങ്ങൾ അവരുടെ ഷെയർ കണ്ടിട്ട് അല്ലെങ്കിൽ somebody would have told you, അപ്പം ആ ഒരു encouragement കൊടുക്കാൻ വേണ്ടി ചോദിച്ചെന്നുള്ളൂ. Jinsiana Jose, good afternoon. Sita Tarshin, good afternoon. So what do we do? In the live, we will discuss two things. One, a part B, and the other one is a part A material which I've already shared. So are you all ready for today's session? No. Ready? A very quick thumbs up. I am ready. To say that you're all eagerly waiting to start to learn. Every day, something. It can be a simple word. Rajimur Praveen is ready. Okay, there are a lot of thumbs up which is going. Excellent. Okay, so this is what, even though you're on a virtual reality, so what I always think is as soon as your messages pops up, I know that you're literally there in front of me. Liba, Jesna, Ashmi, Jinto, Jinsi, all are ready. Excellent. See, we comment ചെയ്ത് പഠിക്കും. Subi Maria, new name for me. Okay, Vidya Ranjan, Bharati, good afternoon. അങ്ങനെ വേണം നമ്മൾ. See, life you have to take that challenge. നമ്മുടെ മുമ്പിൽ വരുന്ന ഓരോ ചാലഞ്ചും you have to start grabbing that opportunity. Rinsi John, ready? അപ്പം ഇപ്പോൾ ഒരാൾ നമ്മളോട് ചോദിക്കുന്നത് ഇത് ചെയ്യാൻ പറ്റുമോ? യു റെഡി, ബി റെഡി ഫോർ ഇറ്റ്. വൈ? യു ആർ എക്യുപ്ഡ്. കാരണം നമ്മൾ ഇത്ര നാൾ പ്രാക്ടീസ് ചെയ്തത് വാട്ട് എവർ ദാറ്റ് യു ഹാവ് ഡൺ സോ ഫാർ ഇസ് വാട്ട് യു ഷുഡ് ബി കംപ്ലീറ്റഡ്. Sita Darshini, ready? Chintu, good afternoon. Chintu Joseph, ready? Excellent. So I would expect all of you to have the very same kind of participation when you are being asked to tell me what is your answer. And now you got the answer. Adanu, upon that part B question, I'm going to share it. Okay, the share chain samayate, not just finding a very quick answer. You have to find, of course. Adu engane kittinu kodunnu alochu. Okay, so there were lots of comment every time when a student comes, after a long time. So a table we have come with today. Okay, a table de idu engane cheyyam allengil there were always text. Okay, so Tina Agnes, good afternoon. A lot of new names, but quite surprised that none of you have told me that you knew. It's Minu Shibin. I started to participate in the class only from yesterday. Thank you very much, Minu. At least very, very kind of you. Okay, Minu, would you be kind enough to tell me where are you from? Just to for me to start saying I know people from these places. That's all. Nothing more. Divya Mol Divya, good afternoon. Princy Babu, good afternoon. Okay. as you all said, you are ready. Bijo Varghese, good afternoon. The question will be coming on the screen. It will say table. Okay, കാരണം ടേബിൾ എങ്ങനെ ചെയ്യാം അല്ലെങ്കിൽ എന്തൊക്കെയാണ് അത് നോക്കണ്ടേ എന്നുള്ളതൊക്കെ അറിയാൻ വേണ്ടിയിട്ട്. So what we thought, we will come up with a table today. I'm from Kottayam. Okay, thank you very much, Manu. Highly appreciated. Ramya Rajesh, good afternoon. So lot of familiar names, lot of like new names. Amruta Singaraj, good afternoon. Madurai, no, Amruta, there you have the question on the screen. So please do find the answer. Subi Maria, Saudi Arabia. Amruta Dev, happy to see you after a long time. Same here, Amruta. Femi Joman, good afternoon. So I'm not going to disturb you. Do the material and then we will discuss. Okay, good afternoon. Thank you so much. There were a lot of lovely students who have been saying that I'm from Subi Maria was saying Saudi Arabia. Then Anita Vijay from Singapore. Okay, fair enough. Vijay from Kuwait. See, so nice, isn't it? See, you have to know that people are there. See, Singapore. Okay, who was that? Anita. See, I think Anita, you're the first person from Singapore. Okay, so this is what happens. It's the diversity. Kuwait, India, Nepal, Bahrain, I'm sorry, Middle East, Australia, New Zealand, England. You have people, you name the country, we have people from all over. South Africa, we have people from Maldives, Sri Lanka. So, yes, all of you have said that you have got the answer. Fair enough. Now, what are the things that you have to really look for when you're doing part B? See, part B, you have to always remember, you have to read the question, understand the question, underline the question. That's very important component. You are expected to find the answer to the question. Okay, generally students in the team, they read the question and they literally forget. No, that's why the keyword underline. And the keyword should be stipulated to, according to the officials who are conducting the exam, they say 2. Adu madi ennaanu parayunnu. But see, we are not as fluent as the others maybe. So maybe at least let's stick it up to 2 to 3. Adi koodudal pogaru. Keyword എന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ നമുക്ക് ആ വേർഡ് നോക്കുമ്പോൾ നമുക്ക് ആ ക്വസ്റ്റ്യൻ ഓർത്തിരുന്നാൽ മതി, അല്ലെങ്കിൽ എന്താണ് നമ്മൾ പാരഗ്രാഫിൽ നിന്ന് കണ്ടുപിടിക്കേണ്ടത് അത് മതി. ദാറ്റ് ഇസ് വൈ ഇറ്റ് ഇസ് കോൾഡ് എസ് കീ വേർഡ്സ്. കീ സെന്റൻസസ് അല്ല. Okay, അപ്പം first thing you do that. After that, you're going to go and read the answer options. അല്ലെങ്കിൽ നിങ്ങൾക്ക് പാരഗ്രാഫ് വായിക്കാം. എനിവേ either way, അത് നിങ്ങളുടെ ഇഷ്ടമാണ്. പക്ഷെ ക്വസ്റ്റ്യൻ വായിക്കുന്നത് ഇമ്പോർട്ടൻറ്റ്. Okay, there you have the question. അപ്പം ഇവിടെ ക്വസ്റ്റ്യൻ എന്താ പറയുന്നത്? It is very clearly asking you what information table is providing. അപ്പോൾ for me, information provided, അത് മതി എനിക്ക് അല്ലേ? അപ്പോൾ ഈ തന്നേക്കുന്ന ടേബിളിൽ നിന്ന് there is some information that I am expected to, it is providing me something, what is that എന്നുള്ളത് മാത്രം എനിക്ക് അറിഞ്ഞാൽ മതി. സി ഇനിയിപ്പോൾ ഈ WH question, ഓക്കെ, these WH question, ഈ WH question is something like we generally say it as 5 wives and 1 husband എന്ന് പറയും. അത് 5 W ഉണ്ട്, ഒരു ഹസ്ബൻഡും ഉണ്ട്. ദാറ്റ് ഈസ് ഹൗ. ഓക്കെ, വെൻ, വാട്ട്, വെയർ, വിച്ച്. അപ്പം ഇതൊക്കെയാണ് 5W, 1H ഇസ് ഹൗ. ഓക്കെ, അപ്പോൾ ആ ക്വസ്റ്റ്യൻ്റെ ആ ഒരു സാധനം ഇറ്റ് ഷുഡ് ബി അണ്ടർസ്റ്റുഡ്. അപ്പം വാട്ട് എന്ന് പറയുന്നതും വിച്ച് എന്ന് പറയുന്നതും വെൻ എന്ന് പറയുന്നതും വേർ എന്ന് പറയുന്നതും gives you a different meaning or a different answer to the question. അപ്പോൾ അത് എപ്പോഴും ശ്രദ്ധിക്കണം. After that, I'm a person who would go behind the answer options. I want to know what I'm searching for in the paragraph before I read. അപ്പോൾ ഇതൊരു ടേബിൾ ആണെന്ന് മനസ്സിലായത്. So shows, അപ്പം my keyword is show. അപ്പം that is important for me. The clinical decision outcome. So അപ്പോൾ എന്താണ് അടുത്തത്, എന്താണ് outcome. So it is showing me outcome. What is it showing about? FRAX. You are for sure to know, isn't it? FRAX and that is an abbreviation for fracture risk assessment tool. അല്ലെങ്കിൽ അതിനു വേണ്ടി ഒരു abbreviation ആണ്. അപ്പോൾ എന്തൊക്കെയാണ്? ഓഫ് ദി FRAX 10-year hip. അപ്പം ഹിപ്പ് ഉണ്ട്, മേജർ osteoporotic fracture risk scores threshold. അപ്പോൾ threshold എന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ that is ആ ഒരു പോയിന്റ് എന്നാണ് threshold എന്ന് പറയുന്നത്. സോ 1 is both ഹിപ്പിൻ്റെ ഉണ്ട്, മേജർ ഓർത്തോപൊറോട്ടിക് ഫ്രാക്ചറിൻ്റെ ഉണ്ട്. Now option B, അപ്പം threshold is a very common terminology for all the three, so I'm not going to worry about. Riskum, it's a common terminology, so I'm not going to worry about. അപ്പം threshold based on FRAX MOF ഒന്നും along with DXA, അല്ലെങ്കിൽ ഓപ്ഷൻ സി എന്താ പറയുന്നത് with FRAX, അപ്പം FRAX HF with or without DXA. അപ്പോൾ ഇവിടെ with DXA, ഇവിടെ with or without DXA. അപ്പോൾ ഇതിനകത്ത് നിന്ന് ടേബിളിൽ എന്തൊക്കെയാണ് തരുന്നത്? സി ടേബിൾ ജനറലി, okay, let it be part A, let it be part B. Okay, table, always the heading of the rows and columns are very important. അപ്പോൾ ഇവിടെ there's no much of a heading given, അല്ലേ? അപ്പോൾ ഇവിടെ എന്താ തരുന്നത്? In the first column they are clearly giving you age, അല്ലേ? ഇവിടെ അവരെന്താ പറയുന്നത്? ഒരു ഏജ് റേഞ്ച് ആണ് അവിടെ മുഴുവൻ പറഞ്ഞു തരുന്നത്, isn't it? So they are giving you age range. The next column they are talking about, it's very similar, അല്ലേ? FRAX HIP, everything. FRAX MOF. അപ്പോൾ ഈ MOFൻ്റെ abbreviation they have given already in the answer option, അല്ലേ? മേജർ ഓസ്റ്റോപൊറോട്ടിക് ഫ്രാക്ചർ എന്ന് പറഞ്ഞു തരുന്നുണ്ട്. ഹിപ്പിൻ്റെ ആണ് അവരെന്ത് ചെയ്തേക്കണേ? HF എന്ന് പറയുന്നത്. അപ്പോൾ ഹിപ്പ് ഫ്രാക്ചർ ആണ് അത്. അപ്പം then everything is the same, അല്ലേ? Second, all the age frame, everything is very similar. അപ്പം it is quite easy to identify. ഇനി കുറേ നമ്പേഴ്സ് തന്നിട്ടുണ്ട്, a lot of statistics into it. അതായത് 70 to 74, 84.6 അങ്ങനെ കുറേ ഫിഗേഴ്സ് തരുന്നുണ്ട്. ആൻഡ് 75 to 79 കുറേ ഫിഗേഴ്സ് തരുന്നുണ്ട്. a lot of figures. ഓക്കെ, ഇനി ഇത്രയും ഫിഗേഴ്സിൻ്റെയൊക്കെ നമുക്ക് ആവശ്യമുണ്ടോ? നോട്ട് നെസസറി, അല്ലേ? അപ്പോൾ ഇതൊന്നും നമുക്ക് ബാധകമാവുന്ന കാര്യങ്ങളല്ല. കാരണം എന്താ? നമുക്ക് തന്നേക്കുന്ന ഓപ്ഷനിൽ നിന്നല്ലേ പറയുന്നുള്ളൂ, അവിടെ ഒരു സ്റ്റാറ്റിസ്റ്റിക്സിനെ കുറിച്ചും പറയുന്നില്ല. അപ്പോൾ വാട്ട് ആർ ദേ സെയിങ്? ഇനി ഇവിടെ തന്നേക്കുന്നത് വാട്ട് ഇസ് ഇറ്റ് ടെല്ലിങ് യു? So now let's see the elimination, which is the most appropriate method. About threshold based on FRAX HF risk factor without DXA എന്നുള്ളതാണോ പറഞ്ഞു തന്നേക്കണേ? ഇല്ല, with or without DXA എന്നുള്ളൊരു കാര്യം നമുക്ക് അവിടെ പറയുന്നില്ല. The first one, again, threshold based on MOF മാത്രമാണോ അവിടെ പറയുന്നത്? അല്ല, HEPും പറയുന്നുണ്ട്, MOFും പറയുന്നുണ്ട്. So it's a very straight answer, which I'm sure that all of you would be telling. I expect all of you to say the right answer. Ini, can you all tell me what is your answer? Or what are your answers? പറയാവോ? എന്താണ് നിങ്ങളുടെ ആൻസർ എന്ന് പറഞ്ഞു തരാവോ? Tell me, what is your answer? A, Minu. Okay, fair enough. Minu is saying A. How about others? Somi is saying A. Okay. Sajna Sajid is saying A. Liva is saying A. Jasna is saying A. Pramita is saying A. Liva is saying A. Okay, excellent. So, ellarkum Jinto Tekkel is saying A. It's a very easy answer. See, നമുക്ക് കുറെ സ്റ്റാറ്റിസ്റ്റിക്സ് തരുമ്പോൾ we come up with a lot of assumption. Amuta Singaraj is saying A. Femi Jomon is saying A. Soji is saying A. Excellent. Lija is saying A. Good. Amruta Dev is saying A. Vijay is saying A. Vidya is saying A. Okay, excellent. So congratulations. It's a very, കാരണം നമുക്ക് തന്നേക്കുന്നതിനകത്തുനിന്ന് ഒറ്റ കാര്യം നമുക്ക് നോക്കിയാൽ മതി. തന്ന പാരഗ്രാഫ് അല്ലെങ്കിൽ തന്ന ടേബിളിൽ നിന്ന് വാട്ട് ഈസ് ദി ആൻസർ, അസംഷൻ അല്ല. അപ്പം അവിടെ ഈസിലി എലിമിനേഷൻ ഇസ് ദി മോസ്റ്റ് അപ്രോപ്രിയേറ്റ് മെത്തേഡ്. കാരണം എന്താ, FRAX MOFനെ കുറിച്ച് മാത്രമല്ല പറയുന്നത്. ബിക്കോസ് ഇറ്റ് ഇസ് ടോക്കിംഗ് അബൌട്ട് FRAX ഹിപ്പ് ഓൾസോ. കാരണം ആ ഹിപ്പ് അവർ നമ്മളെ കൺഫ്യൂസ് ചെയ്യിക്കാൻ വേണ്ടിയിട്ടാണ്. എന്ത്, ഇവിടെ ഹിപ്പ് തന്നു, മറ്റിടത്ത് HF തന്നു. അപ്പോൾ നമ്മൾ എന്ത് പറയും, HF തന്നിട്ടില്ല. സോ ഈസിലി യു ഗോണ അവോയ്ഡ് ഇറ്റ്. അങ്ങനെ ഒരു കാര്യം വേണ്ട. അപ്പം ജനറലി ഐ എം ഹാവിംഗ് ഡൗട്ട് ദാറ്റ് 10 year മെൻഷനിങ് ഇൻ A. സി 10 year എന്ന് പറയുന്നത് വൈ, ഇതൊരു ഔട്ട് ഓഫ് ദ മെനി പാരഗ്രാഫ് ദേ ഹാവ് ടേക്കൺ one small ടേബിളിൻ്റെ ഇത് മാത്രമേ തന്നിട്ടുള്ളൂ. ദേ ഹാവ് അവോയ്ഡഡ് ഡെലിബറേറ്റ്ലി, അവിടെ എന്ത് പറഞ്ഞേക്കണം, ദേ ഹാവ് അവോയ്ഡഡ് എന്ത്, ആ ഒരു ഹെഡിങ് തന്നിട്ടില്ല. പക്ഷേ ഇഫ് യു റിയലി ലുക്ക് ഇൻ ടു ദി ഏജ് ഫ്രെയിം ഒന്ന് നോക്കൂ. സ്റ്റാർട്ടിങ് ഫ്രം 70, ഓക്കെ, ഇനി 85, അങ്ങനൊരു, ഇനിയിപ്പോൾ അങ്ങനൊരു ഇൻഡെപ്ത് ഡീറ്റെയിൽസ് വേണമെന്നുണ്ടെങ്കിൽ, സി ദേ ഹാവ് നോട്ട് ഗോൺ അബ്സല്യൂട്ട്ലി ഓൺ is confusing me. Okay, fair enough. അവിടെ 10 year തരാത്തത് കൊണ്ട്. സോ ഇഫ് ദാറ്റ് ഈസ് ഓൾസോ കൺഫ്യൂസിങ്, അതുകൊണ്ടാണ് നമ്മൾ നോക്കേണ്ടത്. ഇഫ് ദാറ്റ് ഈസ് കൺഫ്യൂസിങ്, സി വെദർ ദി അതർ ഇസ് ഗിവിംഗ് ദ ക്ലോസസ്റ്റ് പ്രോക്സിമിറ്റി. അതുകൊണ്ടാണ് നിങ്ങളുടെ അടുത്ത് എലിമിനേറ്റ് ചെയ്യാൻ പറയും. ഓക്കെ, യു ഗോൺ വെസ്റ്റ് ഫോർ 10 years. ഓക്കെ, വൺ വേർഡ്. ഇനിയിപ്പോൾ ഇവിടെ a threshold based on FRAX HF score with or without DXA. അവിടെ HFനെ കുറിച്ച് മാത്രമാണോ പറയുന്നത്? അല്ല. അവിടെ MOFനെ കുറിച്ച് മാത്രമാണോ പറയുന്നത്? അല്ല, ബോത്ത് അല്ലേ. ടേബിൾ ഇസ് 15 years ഡിഫറൻസ്. അപ്പം ഇത് ഔട്ട്കംസ് ഓഫ് FRAX 10 year ഹിപ്പാണ് പറയുന്നത്. അതായത് 10 വർഷത്തെ അസസ്മെന്റ് ആണ്. ഓക്കെ, 10 വർഷം കൊണ്ട് ഹിപ്പും മേജർ എന്നുള്ളതൊരു ഇതിനെക്കുറിച്ച്, അതിൻ്റെ ഒരു ത്രെഷോൾഡ് ആണ് അവർ പറയുന്നത്. അണ്ടർസ്റ്റുഡ്? സോ ദാറ്റ് 10 year they just added. കാരണം നമുക്ക് തന്നേക്കുന്ന ടേബിൾ ദർ ഇസ് നോ ഹെഡിങ്, നോ ഹെഡ് ഓർ ടെയിൽ അല്ലേ. അപ്പോൾ അതിന് മുമ്പ് എന്താണെന്നുള്ളത് നമുക്ക് അറിയത്തില്ല. സോ മേ ബി ദ പേഴ്സൺ ഹു മെയ്ഡ് ദി കോണ്ടന്റ് നോസ് വാട്ട് ഇസ് ദി ഹോൾ പാരഗ്രാഫ് അബൌട്ട്. അതുകൊണ്ടായിരിക്കും അങ്ങനെ ഒരു ഓപ്ഷൻ തരുന്നത്. Okay, there are these kind of things that just to trick us വരും. ഓക്കെ, ബട്ട് അതുകൊണ്ടാണ് നിങ്ങളുടെ അടുത്ത് പറയുന്നത്, അങ്ങനെ വരുമ്പോഴും the closest proximity answer should be written. ഇപ്പം 2 BC you can easily eliminate അല്ല, അങ്ങനെ ഒരു കാര്യമേ അല്ല. അത് മാത്രമല്ലല്ലോ പറയുന്നത്. Fair enough, that is how it is. അതുകൊണ്ടാണ് നിങ്ങളുടെ അടുത്ത് പറയുന്നത് the most appropriate way to find the answer is elimination, not only in B but also in C. അത് നമ്മൾ എപ്പോഴും പ്രാക്ടീസ് ചെയ്ത് പഠിച്ചു കഴിഞ്ഞാൽ then you can avoid such kind of mistakes. Understood? Yes? Mansilayo, is there any other doubts? I'm quite happy that at least you have some doubts. Okay, quite happy with that. എന്തെങ്കിലും ഡൗട്ട് ഉണ്ടോ ആർക്കെങ്കിലും? Anything that you want me to clarify? Anything that you're not sure about? Illa. Okay. So are you all ready? Thank you. Okay, fair enough. Are you all ready for the next session? That is part A. What is today's part A? Which I've already shared, isn't it? Neethu madam have done that material long back because we were not, yesterday that was something which we never expected. Issue one we were not able to do that part. Okay. So are you all ready for today's part A? No, I'm going to thumbs up. Total penectomy. Easy material, Raju Mol. Okay, fair enough. I like that. Before, now you can even predict what I'm going to ask, isn't it? How was the material? How you felt about the material? Excellent. Good enough, good enough. How about others? Did you all feel the same? Okay. Liba is ready. Rajimol is ready. Just now saying easy material. Okay, fair enough. Pramita is saying Pramita is ready. Okay, fair enough. Liba is saying easy. Okay, fair enough. Vidya Shujal ready. Excellent. Bijo Varghese. So you will have your material on the screen because you've already identified the material and you've given me some insight, which is easy. Generally, very easy and a lot of perspective. And maybe it's because you know that material. Little tough, Pramita. Okay, fair enough. Liba, total penectomy. Jinsi, ready. Okay. So now the question, the screen you will have the material. Abam, generally, see what are the things that you do. See, when you want to do the thing, the first and the foremost important that you always have to remember is how you're gonna do the skimming and scanning. The strategy for part A is called skimming and scanning. Felt little difficult. Okay, ready? About skimming, what are the things that you have to really look for? See, first and the foremost important thing when you're skimming is first underline the keywords. Underline the keywords is very, very, very important. Now, what are the keywords that you're going to underline? Keywords are heading, subheading, letters given in bold letters, italics, numbers, bulleted form, abbreviated form, proper nouns, any new terminology that you're encountering, especially about a disease condition or a procedure. If it's a pictorial representation, the headings, X and Y axis heading, the rows and column heading. So as you go through, don't read word by word, just quick read it. Roughly about, you can take 15 seconds to skim each text. Okay, that's how you could, or how much you could take. Okay, now see, total penectomy, a surgical procedure, and it's performed locally in advanced penile cancer. The procedure removes all parts of the penis, including the roots and the pelvis. This is a significant operation that requires a new opening of a perineum area between the scrotum and the anus. Passing urine in sitting position, this is known as perineal urethrotomy. Lingual pelvic, these are all keywords. No dissection is usually required in candidate with total penectomy. The surgeon might need to remove the scrotum and the testicles. Total penectomy itself, following the good candidate with localized penile cancer. Cancer cannot be treated with other option of penile preserving and tropical therapies. No prior surgery in that area, having a good life expectancy. Okay, after that, go to text B. If you are having a penectomy, gender nullification, removing penis is the final stage in which the bottom surgery. If you are having a gender affirmation surgery, your additional choices about what your genital looks and function. Example, one type of the feminizing procedure is vulvoplasty. Vulvoplasty creates a vulva and the mons, the clitoris, and the outer labia are the tissue associated with being designated male at birth. For instance, the glands and the clitoris. Another type of feminizing surgery is vaginoplasty, a procedure that creates a vagina in the space located between the bladder and the rectum. For a vaginoplasty, genital tissue is used to the form. So genital tissue is used in the form of canal. Vaginal penile inversion vaginoplasty is considered the best option for the gender non-conforming patient. Genital nullification may be choice, and it is smooth, level, and more sync. So individual fields. So after that, what do you do? Go to taxi. Immediate following up the word total or partial is used to need to say short stay in the hospital, typically 1 to 2 nights. Why? Number. It is possible that the temporary catheter is fitted to the brain bladder. The hospital will give instruction in the catheter. The partial penectomy should be always used to urinate through the remaining penis while standing up. So standing up, and you'll be given blood clots, infection, constipation, your doctor will prescribe medical and then doctor will also give you advice on the activities avoided and a recommendation to improve surgery. You may want your lungs to recover the anesthesia. Your doctor may recommend lung exercise, deep breathing, relaxation can only. So after that, you're going to go to the given thing, the management algorithms of squamous cell carcinoma, penile ration, veg biopsy confirmation, squamous cell, so penectomy, non-cancerous lesion, manage appropriately, partial, total. So again, pathologist study features, grade of tumor, depth of invasion, lymphovascular invasion, poorly different, standard, complete iliac, motivated patient, well moderately, depth of invasion less than 4 mm, greater than 4 mm, superficial, frozen section, perforin, complete iliac dissection, frozen, perforin, modified, linguinal block, non-motivated. After doing this, what are you going to do? You're going to go to the question. Okay. Now, even in the question, you are expected to underline the keywords in the question. Okay. See, what are the keywords that you should be underlining in the question? So, keywords. That is after skimming. Okay. See, part A, you are expected to skim the text first. After that, only you go to question so that you have an ideology. Now, I know what is there in text A, what is there in text B, what is there in text C, and what is there in text D. Now, going to the question. Why? Now I told you these are very important things. Why are different drugs prescribed by experts? So why drugs different or different drugs? Now, where have you underlined a lot of drugs and all? Which text have you underlined a lot of drugs? So the answer comes from text C, isn't it? If you really look into, they're clearly saying why these different. You will be given medication to prevent blood clots and all those things. So why? Because there are lots of reasons. So that the answer becomes C. Understood? Now, what? Again, I told you, these kind of keywords are very important. Okay, so what is the purpose behind making new opening? So it is not just any opening, new opening in perineum. So where have you read these words? Perineum, all those keywords. It is there in text A, isn't it? If you really look into text A, what is it? Perineum is as such mentioned where this is a significant operation that requires the use of perineum. So any answer, any doubts with regards to the answer? The answer is text A. So the answer to that question will become A. Understood? Right. Next question. Take always lung exercise. So where are they talking about exercise? You really don't have to worry about any other place, isn't it? There is only one place where they are talking about exercise. Why do you need to take lungs exercise? Your doctor may recommend lungs exercise. So as such, the very same word, isn't it? So answer can be easily identified. Why? The answer is also mentioned in here, isn't it? So the answer to that question is C. So question number 3, the answer is C. Excellent. Now again going back to question number 4. So the answer is C. Cite. So cite means show. The difference between gender nullification and affirmation. So where are they talking about nullification, affirmation? Yes, you're right. Why? The gender nullification, where is it? It is mentioned in text B. Nullification is mentioned. Then, what is the next one? The next one is talking about affirmation. So both the keywords are as such mentioned. So the answer to question number 4 is B. Understood? Good. Right. Now, how far? I told you these are the different WH questions. How far? That means, of course, it is asking about a duration, prolongation, life considered in case of total penectomy. So, where are they talking about how long and all those? Or the life expectancy, where are they talking? That word only in one place, isn't it? A good life expectancy, having a good life expectancy is all mentioned in text A. So the answer to that question is A. Now, precautionary measure. Precautionary means safety measures or something which you're doing it to. So measure taken by pathologist. So again, where are these professional people taking or precautionary measures? So where do you think those are? So pathologist, the very same keyword. What are they doing? They are doing a lot of precautionary measures where? Grade the tumor, depth of the invasion, lymphovascular invasion. These are all something that they are checking. So the answer to that question is D. Okay. Now, next one. What should be the depth? So the answer to question is depth of invasion if thorough paraffin section. So where have you underlined this paraffin depth and all? Again, something which is very much underlined in text D, isn't it? So what is that? What is the answer? The answer to that question is, what is the depth? Depth of invasion. Less than 4 mm, greater than 4 mm. So the answer is D. Good. Now that wraps up 1 to 7. Now the next one, see, you always have to remember 8 to 14 are called short answer question, where you are expected to write the answer as a word, short phrase, or numbers, or a combination of both. You have to by heart this. Okay. Now, title also crowned by penectomy as it creates new opening. So title for new opening area between the scrotum and the anus. So it's very simple, isn't it? Where you get that from text A, isn't it? What is that? All those keywords are as such known. What is the title given? The title is given as perineal ureterostomy. So very straight. perineal ureterostomy. Excellent. Question number 9. So what is question number 9 talking about? Which procedure? Now procedure is a keyword. Procedure provides alternates, many alternates. So alternates regarding the appearance of genitals. So where are they talking about a different thing? So we know that 2 or 3 kinds of things are mentioned where? I know it is in B. Now out of that, which one is it? So it's clearly saying if you're having a gender affirmation surgery. So which is the surgery? Gender affirmation surgery. You have additional choices about the way that you want your genitals to look and function. So the answer is a 3-word answer, gender affirmation surgery. GenderAffirmation So question 10, succeeding step. See, preceding, succeeding is an absolute rhymer, isn't it? Same kind of rhyming, but 2 meanings. Succeeding means next one. To take if the nodes are found opposite to frozen paraffin. So where are they talking about frozen paraffin and all? I know that it should be there in D, isn't it? So what is the additional step for frozen paraffin? The answer is a complete iliac session. Why? If nodes positive frozen, what is the next thing? Complete iliac dissection. Again, a three-word answer. completeliation. Excellent. Question number 11. What is the evaluation technique? So, keyword evaluation technique. Okay, that is enough to assure diagnosis. So, evaluation technique where it is clearly saying to confirm the diagnosis. So, confirm means assure. So, what is the thing? It is the wedge biopsy. Excellent. WEDGE BIOPSY. Excellent. So I'm quite happy that all of you are getting a lot of right answers. And please understand, there will be people who will be coming and giving you such a kind of wrong information and all. Okay. So when such a kind of things are there, please avoid those kind of people. Those are all people who will only rip your money. So please be aware of such kind of fraudulent people. Okay. Right. Question number 12. Device that would be inserted upon for the draining purpose. So very specifically it is asking you a device, isn't it? So what is the device that is being asked? So clearly what is a device? It is clearly mentioned where? In text C. Why? Because the device is called, it is possible to a temporary catheter will be fitted to drain your bladder. So a device that is used to insert to draining purpose, a temporary catheter. With or without the article is fine because it's a short answer question. So TEMPORARYCATHETER. Excellent. Now question 13. What would negatively, see again, the question is asking you negatively. So what is that? It is asking you something which is negative. So something which is negatively affect lung during and needs aids for recovery. So what is it? It is clearly mentioned again in text C. What is the thing? It is clearly saying it is the anesthesia. So where are they saying? You also may want lung to recover from anesthesia. So that is the answer there. Question 14. What is being used to create vaginal canal and labia in vaginoplasty? So vaginoplasty, do you really need any second option? Where? Only in B, isn't it? So what is the thing? The answer is, and see, whatever that we have written as the answer, these are all supposed to be our keyword, isn't it? Whether you like it or not, I have already marked those as keywords already. So the genital tissue is a three-word answer or a two-word answer. GENITALTISSU. Again, the is not a problem. Now, the and all will be a problem. Why? We have gone to the next one. See, the next one set is called fill in the blanks. So in fill in the blanks, you have to be aware of the articles. You can't write the same thing. It's called redundancy. So please be aware of such kind of thing. Again, underlining keywords is important. Standard inguinal block. So where have you mentioned the standard inguinal dissection carried out? Poorly differentiated, partial penectomy. So partial, all those keywords are where? It is there in text D. So what is the problem or what is the answer? The answer is tumor. So where are you? Poorly differentiated tumor. So the answer should only be TUMOR. Now question 16. The requirement of dash dissection is usually seen in the candidates requiring a procedure for penile cancer. So very specifically it is asking you. So where are they talking about penile cancer? Do you have a second thought about it? No, go straight to A, isn't it? Go straight to A because that is where that penile cancer and all is mentioned. So what is that problem? The problem is inguinal pelvic lymph node. Please understand this is a hyphenated word and you're expected to write with hyphen. INGUINAL hyphen PELVIC LYMPHNODE is required for total penectomy. So question 17. Dash could be the chosen could be chosen for gender non-conforming people as their genitals are area smooth. So non-conforming, so gender non-conforming. So what is that? May have choice, smooth, and all those other keywords. So what is the choice? Genital nullification. GENITALNULLIFICATION is the answer. Excellent. Now, in-depth respiring and relaxation. Now, see, these are all keywords, isn't it? We deliberately gave you this. So, what are they saying? In-depth respiring. So, what is in-depth respiring? Deep breathing. So, relaxation. Where? Maintain lung health, aid flushing of dash. So, something has been flushed out. So, what is the thing that is there? So, anywhere you know where you have underlined these words? Anywhere? You have underlined these words where? Deep breathing, relaxation, maintain lung, facilitate drainage. So the only two things which is missing is what? Lymphatic fluid. LYMPHATIC Now penultimate question for today. Question 19. An individual is able to stand up, urinate, remaining penis. So where is this remaining penis? Stand up. All these keywords are as such should be there somewhere in C. Why? If you have a partial penectomy, you should be able to urinate through the remaining penis while you are standing up. So what is the answer? Partial penectomy. Do you have to write the article there? No, if you write the article your answer is wrong. Why? Is already mentioned in the question. So the answer should only be PARTIAL PENECTOMY. Excellent. So the ultimate question for today. Question 20. Nowadays is considered best option feminizing surgery. So feminizing surgery, where are the three options given? It's there in B, isn't it? So it's there in B. So where are they talking about? What is the best option? So best option is clearly mentioned where? It is there in text B because it clearly says currently, nowadays, paraphrased. Penis inversion vaginoplasty is considered the best option. So the answer is a three-word answer. PENISINVERSION VAGINOPLASTY. So I have wrapped my 20 answers. I have blasted my 20 answers. Now it's high time that you start telling me what are your total scores, or if you have any doubts with regards to any of the answers that I've told. Anything that you're not? Pramita 20, absolutely good enough. Excellent. Keep on dancing. Why not? Good enough, good enough. How about others? Do shoot your Rajimol 19. Excellent, good enough. Keep it up. Do give me your total scores. And if you have any doubts, please do clarify. No problem at all. Lieber 20. Excellent. Good enough, good enough. Good, good, good. Jasna Noble 20 out of 20. Excellent. Keep it up, keep it up. Good. So any doubt with regards to any of the questions? Because I don't know why you're reluctant to tell your marks. Just because that others have told 20? No, it is not about others. I want all of you to start telling whatever is your score. Be happy with that. And next day, fair enough, Jinsi, 18, good enough. You have to learn. See, go back and see why you made that mistake. Why you didn't go with the keyword. If you would have gone with the keyword, all these answers would have been a piece of cake. Liba, thank you. Fair enough. Okay. Any general doubts that you want me to clarify? അങ്ങനെ എന്തെങ്കിലും ഉണ്ടോ? ഉണ്ടോ? ആർക്കെങ്കിലും എന്തെങ്കിലും ഡൗട്ട് ഉണ്ടോ? ഇല്ല. Okay, because you don't have any doubts. Because we're all there. Okay, the hard work that you have put, the effort that you're putting, that's where you are. Okay, so thank you very much for giving us another opportunity. It was a pleasure to come in front of you all. Okay, really looking forward to see you all tomorrow. Until we come in front of you tomorrow, adios from all of us from Neethu's family. God bless you all. Take care.